The ribs are stable in their elevated, locked position. More stability is noted with the breath in. Ribs on the right are firm. Ribs on the left, during a sustained breath in, feel like a worn-out mattress. No spring when the same force is applied. During the setting phase, the scapula should remain stationary. Movement of this right arm results in very little or no movement of the scapula. This unwanted left scapular movement was palpable but not visible until about 8 months post-injury. Crepitus often accompanies this dysfunctional movement. Rib movement can be shown by resting fingers on the tops of the ribs. As the right arm is lifted overhead, notice how the fingers separate. The ribs are lifting so the chest wall can support the arm as it is elevated. Side bending left will illustrate the same phenomenon. With individual fingers still resting on the ribs, a side bend to the left will cause the fingers to separate. Active elevation of the ribs will provide support and mobility to the thorax. When the arm is lifted, the fingers on the left arm remain stationary. The left arm drags the scapula upwards, but the ribs cannot follow. Their intimate connection with the scapula is lost. Side bending right will also result in no lifting of the individual ribs. The left side of the thorax will move like a piece of wood, just like the puppet on the cover of my books. Additional lumbar and cervical motion may accompany active side bending, but this cannot replace normal active rib function.